Next action is immunosuppressive action. Corticosteroid is well known as immunosuppressant. It mainly affects cell-mediated immunity, which is mainly involved in the rejection of organs which are transplanted, or mainly involved in autoimmune diseases. It inhibits the proliferation of T cells. That is the reason why it selectively inhibits cell-mediated immunity, and a direct lympholytic effect on cytotoxic T cells and inflammatory T cells. And it also inhibits the release of antigen from the grafted tissues, preventing host versus graft rejections. Anti-asthmatic effect. It is well known as mainly used for chronic treatment of asthma. The main reason it induces one protein as a mechanism of action mentioned. It induces a protein synthesis known as lipocortins, which suppresses phospholipase A2, which is the enzyme responsible for the production of prostaglandins as well as leukotrienes, LTS leukotrienes. So leukotriene is one of the major mediator of asthmatic attack in human beings. So the increased production of lipocortins will decrease the production of leukotrienes, and that will reduces the frequency of asthmatic attack. It increases the number of beta-2 receptors in the bronchial smooth muscles, and also improve the sensitivity of these receptors to the beta agonist or any of the endogenous catecholamines, and improve the bronchodilatory action of beta-2 receptor agonist as well as catecholamines. And it also inhibits the cells which are involved in the airway inflammation, reduces the number of mast cells in the airways, inhibit plasma exudation as well as mucus secretion, which are again the complication associated with the asthmatic attack. Adverse effect of systemic corticosteroids administration. In the classification itself, it is mentioned the corticosteroid is classified as which are given systemically, which are given by inhalation route and by topical route. So systemically, when the corticosteroid are administered, what are the side effects? The main one, first, hyperglycemia, already mentioned. It is having hyperglycemic effect. Second, it redistributes the subcutaneous fat, leading to Cushing's habitus. Hope you remember fish mouth, buffalo humps, and moon face. Thinning of the skin due to the breakdown of the protein, muscle wasting and myopathy, again due to the protein effect on protein metabolism, osteoporosis, especially spongy bones. Hypertension and fluid retention are mainly observed with the corticosteroid, which shows more mineralocorticoid activity. Peptic ulceration, because it increases acid secretion as well as the pepsin secretion, and also decreases the prostaglandin protective effect on GIT. It causes immunosuppression, which can lead to opportunistic infections, especially viral infections, because cell-mediated immunity is mainly acting against viral infections. And the last one is adrenal insufficiency, mainly due to the suppression of HPA axis. This happens when the drug is mainly taken at the night time, and the drug is active during the morning, which will lead to a negative feedback effect on HPA axis, that is hypothalamic pituitary adrenal axis. That will lead to decrease in corticosteroid secretion in the early morning hours, which is responsible for decreasing the stress as well as improving the brain functions. Psychiatric disturbances and cataract formation, glaucoma, when it is used for a long time. On inhalation, what is the side effect? All the above side effects are not observed when the drug is inhaled, but the main side effect is oropharyngeal candidiasis due to suppression of immunity, and it can be easily prevented by using a reservoir device or a spacer while inhalation, or the best way is to rinse the mouth after each inhalation. Second side effect on inhalation is dysphonia, that is disability to produce voice, and hoarseness of voice, changes in voice quality. This is what usually seen after the chronic administration of corticosteroids. This is what is called Cushing's habitus. Only for your reference. How to avoid these unwanted effects? So presently recommended administration of corticosteroid is as follows. Use short course or a low dose whenever it is possible, and withdraw the chronic steroid therapy slowly, that is tapering the dose. The dose initially what you give, that has to be reduced slowly while withdrawing the drugs. Do not withdraw the drug suddenly. Give dose once daily and most preferably in the morning hours, so that it will complement with the morning corticosteroid secretion and will not affect the HPA axis and do not cause adrenal insufficiency. And recently it is also mentioned that drug dose can be doubled and it can be given alternatively or on alternative days. So that is the alternative days if possible. If the dose what supposed to be administered is 5 mg of prednisolone, it can be made 10 mg and can be administered in alternative days, so that it can have least effect on HPA axis. Indications I am giving in separate headings, kindly note down. One is replacement or supplementation therapy. So corticosteroid is usually an endogenous steroid. So it can be supplemented when it is deficient in the following condition, like acute or chronic adrenal insufficiency, Addison's disease or Addisonian crisis. Pharmacotherapy in AI disease. I mentioned there AI, autoimmune disease. So you can write any of the autoimmune diseases. Under that I am giving few examples like rheumatoid arthritis, lupus erythematosus, autoimmune hemolytic anemia, multiple sclerosis, myasthenia gravis. Next use third one, neoplastic disease. The numbering is missing. Third use in neoplastic disease like leukemia, lymphoma, multiple myeloma, because they show lympholytic effect. Fourth use, inflammatory conditions. Number is again missing, kindly note down. Fourth use, inflammatory conditions like gouty arthritis, osteoarthritis, bronchial asthma, status asthmaticus, hydrocortisone IV administration mandate for status asthmaticus. Aspiration pneumonia, again hydrocortisone is a drug of choice. Meningitis or acute cerebral edema. Optic neuritis, because of their powerful anti-inflammatory action, they are useful in all these conditions. Topical uses, they are useful in case of urticaria, various type of dermatitis, any type of dermatitis. Psoriasis, they are also tried along with the vitamin D preparation, can be also used like calcipotriol, but psoriasis is an autoimmune disease, so corticosteroid can be also used. Allergies like allergic conjunctivitis, allergic rhinitis, serum sickness, insect venom allergy, anaphylaxis, and septic shock, hydrocortisone is given by IV route. Prevention of infant respiratory distress syndrome, usually the delivery or parturition is postponed and the corticosteroid therapy is started to promote the lung maturity in the infants or in the fetus. Transplant rejection reactions, it can be useful for both host versus graft as well as graft versus host disease. In dentistry, it limited uses, but still it can be used in recurrent case of oral ulceration, TMJ, post-operative problems, topically for after ulcers, angular stomatitis or cheilitis, emphagus, erosive lichen planus. Coming to contraindication, kindly find out the contraindication. You can write by your own, because if you study the pharmacology action, initially you see hyperglycemia. So where it is contraindicated? It is contraindicated in patients with diabetes mellitus. But seen it affect the calcium absorption and increases the bone resorption. So it is contraindicated in patients with osteoporosis. It causes increase in blood pressure, so contraindicated hypertension. It is contraindicated in viral infections, but Remember, it is used for tuberculosis except GI tuberculosis. All type of tuberculosis, whether it is pulmonary or miliary tuberculosis, corticosteroids can be used except GI tuberculosis because it can lead to perforation of the GIT. Corticosteroid antagonist mifepristone, just mentioning the drug, it blocks glucocorticosteroid receptor as well as it is anti-progestin. Progesterone hormone, progestation, promote gestation. It is a hormone which promote pregnancy or support the pregnancy. So it is mainly used for MTP, medical termination of pregnancy of almost 7 weeks, not more than 7 weeks. Thank you.